In our last episode, we examined the debate about which technology you should use first in 6-in-1 fat reduction protocols, cavitation first or RF first. Well, the answer did not surprise us, but we did learn something, and that is that there's a whole lot of body contouring practitioners who probably don't quite understand that there's critical differences between different RF machines, like what they can improve, how much they can improve, the level of safety of the machine, and the cost of the machine. Most of the differences come down to where the positive and negative RF electrodes are located in the handpiece and the machine, which defines the machine as monopolar RF or bipolar RF. Well, we want to clear it up for you and for you to be in the know about this topic. It's important. So stick around and listen, because in today's episode, we examine the merits of monopolar RF versus bipolar RF, and we break down the skin tightening and fat reduction abilities of each. So stay tuned.
You're listening to the Body Contouring Academy's Proven Profits podcast, where you'll learn simple, actionable strategies from real-world, successful body contouring professionals to help you generate more revenue, realize the profits you want, and create the life you desire. Hi, I'm Shannon.
And I'm Kay.
And we're your hosts of the Proven Profits podcast.
Hi there, healthcare professionals, business owners, body contouring technicians, and beauty professionals. Welcome, everyone. Kay here. Shannon and I want to thank you for being here, too. In our last episode, we broke down 2 6-in-1 fat reduction protocols. Ours, using cavitation first, and one taught by a device manufacturer which uses RF first. And it was in the making of that episode that we realized there's a lot of misunderstandings about radio frequency technology and what it can do. Hence, this episode. We wanted to make sure you understood. Now, radio frequency is one of the most useful of all the non-invasive body contouring technologies. It's the gold standard for skin tightening, plus some RF machines possess the ability to reduce fat. But exactly what each RF machine is capable of improving and how much improvement it can deliver, well, that varies a great deal from machine to machine. Specifically, much of it boils down to the manner in which the particular machine delivers the radio frequency electrical energy to the body, which comes down to the placement of the radio frequency electrodes. Does the RF handpiece have 1 electrode or 2 electrodes? Is it monopolar RF or is it bipolar RF? Well, in today's episode, we're going to examine both monopolar and bipolar RF and the merits of each. We're going to break down their skin tightening and fat reduction abilities. Plus, we're going to share the proprietary RF protocols that we've developed and still use in our med spa, and we'll fill you in on how you can get them and use them too. So, let's get started by laying the foundation with a review of some radio frequency basics. Radio frequency technology delivers radio frequency energy to the surface of the skin via your handheld applicator. Now, the RF applicator emits that radio frequency energy directly to the skin, which is then converted to heat energy in that targeted area, that targeted tissue. Now, this controlled heating sparks skin tightening, and in some RF machines, also fat reduction. Now, regarding skin tightening, when collagen cells and elastin cells are heated, the body reacts by producing new collagen and new elastin, which results in improved tone, improved skin smoothness, skin strength, and elasticity in the skin in the treated area. Now, regarding fat reduction, when the fat cells are heated to a high enough temperature, apoptosis is initiated, which results in the destruction of fat cells and a reduced circumference in the treated area. Now, a little bit about the RF electrode configuration. Radio frequency machines differ by the configuration of the electrodes, the placement of them in the applicators. It's these electrode variations that classify the machine as monopolar RF or bipolar RF. So now let's dig in to today's subject matter and start with monopolar RF. Well, what is monopolar RF? Well, in monopolar RF, the RF positive and negative electrode placement, they're located a good distance, far away from each other. With monopolar RF, the positive and negative electrodes, one is located in the handpiece, and the other electrode is located in either a grounding pad or plate, depending on the terminology that's used with your machine, and it's positioned under or at least on the other side of the patient's body. So if you're treating the abdomen, it would be on the back. If you're treating the arm, you're going to be treating the front of the arm, it's going to be behind the arm. Now, because the positive and a negative electrode poles are positioned on either side of the patient's body, far away from each other, the radio frequency electrical currents, well, they have to travel through and therefore affect all the layers of the skin, the epidermis, the dermis, the subdermis, as well as the subcutaneous tissue, which includes those subcutaneous fat cells. So with monopolar RF, you can obtain deep penetration of that radio frequency energy. Now, what differentiates monopolar RF from bipolar RF is that deep tissue penetration, which results also in powerful collagen regeneration and as well as the fat cell destruction. That dual action of monopolar RF firms the skin while simultaneously reducing fat and sculpting the body. Therefore, monopolar RF is the choice when you are wanting to achieve fat reduction and you're wanting to improve severe skin laxity. So let's go over monopolar RF in a nutshell by discussing their pros and cons of monopolar RF. Well, the pros, which you've just heard, deep tissue penetration, really good collagen remodeling, and it's an effective treatment for fat reduction. Now, the cons are the treatments, because it's powerful and delivers a lot of energy, your treatments are going to be limited to large areas. You're going to have to really be moving that RF handpiece over a larger area. And it can potentially deliver discomfort to your patient. It requires a specific heating, so you're going to need to be monitoring that temperature that you're of the energy that you're delivering. And monopolar RF machines generally, they're more pricey, they're more expensive. So now let's take a look at bipolar RF. Now in bipolar RF, the RF positive and negative electrodes, as you might guess, are positioned much more closely to each other. With bipolar RF, both of them are going to be located, both those electrodes are going to be located in the handheld RF applicator. Well, this means that the RF current is only going to be flowing between those two electrodes in the handpiece, and so it's not going to penetrate much further into the body. So think about with monopolar, you've got that electrical current going from one side of the body to the other and back. With bipolar, they're both there, so they're just both, it's kind of going back and forth, and penetrating the skin, but not near to the same depth as with monopolar. So the penetration is superficial, but bipolar RF can produce collagen and elastin regeneration at both the epidermal and dermal layer. It does not penetrate deeper into the tissue, though. It does not affect subcutaneous fat. But because of its superficial nature, bipolar RF is a safer option for body contouring beginners, although caution is still needed when operating. So it will produce a strong heat sensation, localized redness, and so it makes your instruction and certification in your RF treatment technique, even if it's bipolar, it makes it critical to both safety and best results. Now, it does have the safety edge, and we know that many of you are using the 6-in-1 for your RF skin tightening treatments, and also using RF as part of your fat reduction protocol. Well, the RF that's housed in the 6-in-1 machine, it's bipolar RF. If you want to learn more about it, you can check out our course, the Body Contouring 6-in-1 Masterclass. We left you a link for the details of that course in the show notes. Just remember, you're going to get superficial RF penetration with bipolar RF, and that gives it a definite safety edge. But you're not going to be able to have deep tissue penetration and affect that subcutaneous fat. But it's a great booster to your fat reduction protocol that you are when you're using cavitation with the 6-in-1. So bipolar RF is the choice for localized skin laxity. Dermal structures are going to be affected without damaging surrounding tissue. It's going to be very precise in its targeting. So it's many practitioners' go-to technology for inner thighs, upper arms, and then to treat a smaller area in the abdomen. So that is, let's look at bipolar RF in a nutshell like we did monopolar by looking at the pros and cons of bipolar RF. The pros, we've been talking about them. The treatments are usually pain-free because you're not getting that deep penetration. So it's ideal for surface-level improvements. It's especially compared to monopolar, there's a high degree of safety, and we feel it's more suitable for body contouring beginners. It's recommended over monopolar RF for sensitive areas like the inner thighs and the upper arms, and it's generally less expensive. These are more affordable machines. What are the downsides, the cons? Well, because it is limited to superficial tightening, and also you cannot realize fat reduction because of the superficial RF penetration. Now, here's something we want to share, and it's our secret to reducing fat using bipolar RF. Now, remember, while bipolar RF cannot affect fat cells on its own, combining the skin tightening power of bipolar RF with the fat blasting power of ultrasound fat cavitation using our protocol, well, it delivers truly transformative body sculpting results. Remember, you can get our combination cavitation radiofrequency protocol in our RF course, which is covered in our Body Contouring 6-in-1 Masterclass. Well, we hope that the information in today's episode has answered questions. Did it? Are you clear now on monopolar RF versus bipolar RF? But just remember, here's some things. In deciding between monopolar RF and bipolar RF, the right choice, well, it depends on the majority of your client's needs and your treatment goals. Monopolar RF, well, it's a go-to for deep tissue effects. It offers powerful fat reduction and significant skin tightening for larger areas, but it's a more risky treatment and the machines are pretty pricey. Now, on the other hand, bipolar RF is ideal for the precise surface-level skin tightening and addressing sensitive areas, and it's a safer option for beginners. Plus, the machines are a lot more affordable. With the right training and the best protocols like the ones we offer in our certification courses at the Body Contouring Academy, you can decide on which machine to use based on the unique benefits of each RF type to achieve outstanding body sculpting results. Well, we hope you learned a lot today. That's it for today's episode. We hope you join us next time, and until then, beautiful wishes.
Are you ready to expand your business, boost your income, and enhance patient care and satisfaction effortlessly? Our game-changing online courses pave the way for seamless service expansion, all without a huge investment, endless research, or risky endeavors. Our courses provide comprehensive insights into cutting-edge technologies, step-by-step treatment protocols, downloadable resources, and more. After completing each course, you'll have the knowledge to deliver desired results and generate maximum revenue. Visit bodycontouringacademy.com, click on certification courses from the menu, and discover the courses that can transform your business today.